welcome back to my channel, and today I'm going to talk about ultrasound worksheet. So when you are a sonographer, another word for that is an ultrasound tech, you often or always use worksheet every time you submit your images to the radiologist. That's one thing that we do here in our area. I don't know of any place in our area that doesn't use worksheet every time you do an ultrasound with a patient. And so I'll definitely show you what to put in the worksheet and how different types of worksheet looks like, because they're quite different. And it's gonna help you, especially when you start working. If you're still a student and you start working, or even in clinicals, and it's not gonna be new to you, hopefully. So ultrasound worksheet in general, lab consists of abdominal worksheet, GYN worksheet, non-OB GYN, that's what it is. First trimester, second trimester, breast ultrasound. If the place that you work has to do breast, you have to have a breast worksheet. Kidney, which is renal ultrasound. What else? Thyroid, testicle ultrasound. I think that's pretty much it. So anyway, the pros and cons of having a worksheet. So the pros is that it helps you streamline your work. So when you submit your images to the radiologist, it kind of already helped them to give a little bit of overview of your work. Like, for example, they don't have to check the measurement in each pictures that you took. They can just go on a worksheet and then they can see the measurement. Or some radiologists, they still want to double check because some ultrasound tech might, mistakenly put the wrong number. So let's say just an honest mistake, you put the measurement of the right kidney into the left kidney worksheet. You know what I mean? So that's also the cons of having a worksheet. So you have to make sure that what you write in the worksheet is correct. Otherwise, it will kind of look, I don't know how to describe it. It kind of probably looks stupid on your part for having that mistake. Maybe not stupid, maybe that's not the word, but I don't know, but make sure that when you write your worksheet, it's the correct one. I've learned that the hard way. Okay, so that's basically it for this video, and hopefully this will help, especially if you're just a student starting to do ultrasound. At least it can guide you, oh, that's how it looks like, and that's what you write in a worksheet. It's pretty much good stuff. So stay tuned. I'm gonna let you see how it looks like. All right, so with this worksheet, it says over here, general worksheet. So with general worksheet, we normally use this one if we do like an abscess, to check an abscess of the arm or in the leg or in any area of the body or in a foot. Like I've experienced having to do an ultrasound of this lady's heel area because she said she felt something in there. So basically just to check if there's any fluid or abscess. So in here, you just put the patient's name, or if you have a patient sticker labels, you just stick it in there. Then you put the MR number is usually like the patient's ID number, or like the order that says MR. That's where you put it right there. The ordering doctor who ordered that ultrasound. Then obviously the age, and then sex, or female, male, the date, then your initials right here, like whoever who did that ultrasound. Exam type, you say limited quadrant. related studies, that means like if they have like a previous study which is similar to what you are about to do. So area of interest, let's say it's the right arm, so you just put right arm or right leg, and then the complaint as to the reason why they doing that ultrasound, and then the appearance of the ultrasound. Let's say if you see fluid, you can just say, you know, fluid seen, area of interest image, and then fluid seen, something like that. So you just make sure that you just simply describe it like in a minimal way, not too much. Most radiologists, depending on where you go, you know, they just like it like a really minimal description. So the next one is breast sonogram. So we rarely do this in the hospital that I work with, so I have not really used this worksheet yet so far. So it's the same thing. You just have to fill out, you know, over here, and then indication complaint, and then over here you put, if there's like a cyst or pathology that you see, you just kind of draw where it's at. And then you just check pathology present, yes. Normally we don't check these, we just kind of draw. And then location, size, number, echogenicity. We usually don't do that, depending on the hospital that you work with. So Gyn sonogram. So if you do like a transvaginal ultrasound or transabdominal where you look on top, so it's still the same thing. You just need to fill out all this information right here. And then you check if you did a transabdominal or transvaginal or both. And then your initials. It's very important in the Gyn sonogram or first trimester sonogram to put their LMP, last menstrual period, because that's gonna dictate in comparison to their endometrium. That's gonna help the radiologist. One time I didn't put the LMP, so the radiologist asked me, you know, like, do you know the LMP of this patient? So it's very important to at least ask that from the patient. If they don't know, just put none or cannot remember. And then over here you have beta HCG. This is like a blood test that the nurse will do if the patient just to see if the patient is pregnant or not. So it's very important, especially if you call vision, the night vision, if you work at night, they want to have this. But in my workplace, we normally don't put it unless if it's concerning or the beta HCG is high, you know, and we don't see any intrauterine pregnancy. And gravida, how many times the patient got pregnant, and then how many live births. So you just over here uterus, so you put present or absent, and then over here we just put the measurement of the uterus. And then we usually don't check all of these. The one that we check is if we see any fluid. So we check yes, and then location, if it's like posterior to cervix or where it is. And then if you see something in the uterus that's like a pathology, you just describe it here. So again, with the description, you have to be minimal, like if it's anechoic, hypoechoic, hyperechoic, hypervascular, and all that stuff. So you put it here. And then right ovary, left ovary, still the same. You put the measurement, if it's present or absent, if you see follicles. Blood flow is very important. You have to take a blood flow when you do ovaries. And then if you see any pathology, you write in the comments below. And then indication, complaint, you know, the reason of the exam. The next one is Thyroid Sonogram. So still the same thing. You have to fill this one out. And then the right lobe, left lobe, the measurement. And then over here in my workplace, we only checked if there's color. You check that. That's really the one that we will just do. Otherwise, we don't really do anything in here. We just put the measurement and then the isthmus. And then if there's any pathology or nodule, we draw where that nodule is. You know, this is in trans. So you just draw where it's at. That can help them figure out where exactly the nodule is, aside from looking at the picture. So in this one, you have a biophysical profile sonogram. So it's BPP for pregnant women. So again, you have all of these. Just fill this one out. And in BPP, this is just a 30 minutes exam. So when you go do this exam, you want to make sure you inform the patient that this exam I will only do this exam for 30 minutes. So within 30 minutes, you do, you know, your heart rate, and then after that, you just kind of see if there's any movement. So gross movements, flexion and extension, and then tone, closing of hand or clenching of foot, respiration, if the baby's breathing, practice breathing, and fluid. So, and then the score is either 2 or 0. So 0 or 2 points given. So you just scored each in here, and then it should be a total of 8 or whatever you put in. It might be 6/8. So it will show you right here. So what that scoring entails. This is quite really nice to just kind of guide you. You know, if you want to score the patient 4 out of 10, you want to make sure if it's really 4 out of 10. Okay, otherwise they have to consider delivering the baby. And then if you will add like additional comment, like, you know, something like that, you put it over there. And of course, we don't check this one. None of these. We just put the indication or complaint. So the next one is Abdominal Sonogram. So this is an abdomen complete ultrasound where you're looking at taking pictures of liver, gallbladder, right kidney, left kidney, pancreas, spleen, aorta, and IVC. So as usual, as I've said earlier, you just fill out all the information right here. And then the measurements of each organ, you put all the measurement. And then in here, the liver, we only checked if there's fluid, if you see any fluid, yes or no. And then in the comment section, you will put in there if you see any pathology, like if you see cysts or gallstones. But the way we were taught in school, you're not going to say cyst seen or, you know, gallstone seen. You basically have to describe the pathology. For example, if it's a cyst, you'll say anechoic foci seen, you know, in right liver, or if it's a gallstone, you'll say echogenic structure seen. Then in right kidney, left kidney, we only put measurement, and then if we see any hydro. All right. In pancreas, we always check limited because most often we don't usually see the whole pancreas. So we might be able to see the head and then the body, but not the tail due to bowel gas. So we always advise to check limited, and that's pretty much it. And then the aorta, you do put the measurement of proximal, mid, and distal aorta, and then the iliacs, the aorta bifurcation where they split into two. So if you see them, click yes, put the measurement in. And then IVC, if you see it, you put yes. The spleen, we only put the measurement. And then, so here, the gallbladder, we only put the measurement here. And then if the patient have their gallbladder removed, you checked this section. All right, and then common bile duct, we only check here. So for inpatients, I was taught that we always encircle medicated, and that's for inpatient. But otherwise, we have to check if there's a Murphy sign or no Murphy sign, which is the minus. So the Murphy sign, you want to make sure it's a true Murphy sign. And one of the radiologists taught me that Murphy sign is when you put the probe in and like the patient will jump because of pain. That's a true Murphy sign. All right. So on ultrasound, when the patient have a Murphy sign, usually patients will have a thickened gallbladder wall with pericholecystic fluid. All right, that's already most often. But I also seen, they have a thick gallbladder wall, but they don't have a Murphy sign. So it really just depends. But normally you can see a positive Murphy sign if there's an acute cholecystitis. It is elicited by firmly placing a hand at the costal margin in the right upper abdominal quadrant, and you can ask the patient to breathe deeply. The next one is kidney ultrasound or aorta if you're doing an aorta itself. Now, for this worksheet, you're basically just doing the right kidney and left kidney and bladder. Now, we have what we call a retroperitoneal complete. So that means if it's a complete, you have to look all of these. IVC and then the aorta itself. Now, if the order is just right, renal limited ultrasound, then all you do is look for right kidney, left kidney, and bladder. That's all. So you're gonna cross this one out and then cross this one out. And as usual, you fill out all these information right here. You put the measurement of both kidneys, and if you see hydro, you put present or absent. If you see pathology, you put comments in there. Then the bladder, you put if you image them, and then if the patient have a Foley catheter, you just check that one out. And then, so that's basically a renal limited ultrasound. Now, if it's a retroperitoneal complete, then you will include IVC and then the aorta, and then the measurement, and then the aorta bifurcation right here. So again, you don't check any of these, at least in our workplace. We don't do that. But we always put the indication complaint.
as to the reason why the patient is doing this ultrasound. It is usually found in the ultrasound order, so you just copy it right here. Alright, so yeah, that's pretty much it. But if you're doing just an aorta ultrasound, so you cross this one out and then just do these. So that's pretty much it. And then the next one is OB sonogram. You fill this one out. Alright. So in OB sonogram, you always have to ask their LMP and then gravida and para. That's very important. And then you just put all the measurement right here. And then you just do the same thing. If you see any of these, and then comments as to what you see, and then indication and complaint. That's what you're gonna do. The next one is another OB sonogram, and this time it's the 2nd or 3rd trimester sonogram. So above, when the patient is already 12 weeks, then you'll do 2nd trimester. Then again, you just fill this one out, and then if you see single or multiple. And in our workplace, we only will do this one, so we cross that one out because we're only doing OB limited. We're not doing everything. So then you do fetal position if it's breech or vertex, then the heart, and then placenta location if it's posterior, fundal, or anterior. Then your measurement. Depending on where you work, you might have to do all the measurement like the BPD, head circumference, and so on. Or in my other workplace, we only do the femur length because that's usually the right measurement. Otherwise, you will do all of these. And then you put comment on, and then indication and complaint. And then the next one is testicular ultrasound. Same thing. Fill this one out right here. Indication and complaint. Then the measurement of each testicle. And then over here, the only thing that we will check or not is you definitely have to do color and the Doppler flow. So you put present or absent, if you see the epididymis, and then if you see any fluid seen. So these 3 are the most important part. We don't even check any of these 2. So just this one, including the left testicle. Now, if you see any pathology, so we'll kind of draw where the pathology at. So if we see, for example, like a mass or a cyst, we just draw like where it is in the picture. So, and that's pretty much it. We have covered all the worksheet in general ultrasound, and if you have questions, let me know. Hopefully this is helpful. All right, thank you guys for watching.